Stop sleeping like that. Seriously, the position you've used for decades could be quietly damaging your health, and you won't feel it until the damage is already done.
If you're over 60, sleep is no longer just about comfort. It affects your heart, your brain, your spine, and even how long you live.
A major study in the Journal of Clinical Sleep Medicine followed over 12,000 adults for nearly 10 years. The result shocked doctors. Certain sleep positions raised cardiovascular risk by up to 34% in older adults.
34% just from how you lie in bed at night.
And it gets worse. Researchers at Stony Brook University found that poor sleep posture can reduce the brain's ability to clear toxic waste by over 40%.
That waste includes amyloid beta, the same protein linked to Alzheimer's disease. So while you think you're resting, your brain may be under silent stress.
But here's the good news. Scientists have identified sleep positions that protect you, improving circulation, supporting the spine, and helping the brain clean itself properly.
No equipment, no medication, just knowing what to avoid and what to do instead.
In this video, we'll count down the 4 sleeping positions people over 60 should stop immediately and show you the safer alternatives backed by real clinical data.
We saved the most important one for last. A 2023 Stanford study found that changing one position reduced nighttime oxygen drops by 61% in seniors with breathing issues.
Before we begin, tell us your age and where you're watching from in the comments. We read every single one. And subscribe our channel, Longevity Steps, for more science-backed videos. Let's start with number 4. Avoid the twisted torso. Use the aligned spine position instead.
The twisted torso is incredibly common. Your upper body faces one way while your hips or legs rotate the opposite direction, creating a slow corkscrew through your spine.
When you're younger, your spine can tolerate this, but after 60, discs lose hydration, flexibility drops, and recovery slows down.
A study in Spine Journal found that over 70% of adults 60 plus already show disc degeneration. Adding nightly twisting dramatically accelerates the damage.
This position creates uneven pressure on your vertebrae and facet joints, compressed on one side, overstretched on the other, leading to inflammation, stiffness, and chronic lower back pain.
Researchers at Johns Hopkins found people who slept twisted were more than twice as likely to wake up with prolonged morning back stiffness.
But here's what most people don't realize. This position also affects your internal organs. When your spine twists, your torso twists too, compressing the stomach and intestines.
Seniors sleeping this way reported nearly 50% more nighttime heartburn.
The fix is simple: the aligned spine position. Shoulders, spine, and hips all facing the same direction, one straight line from neck to tailbone.
Sleep on your side with a pillow between your knees. This prevents your top leg from pulling your hips into a twist.
If you roll onto your back, place a body pillow or rolled blanket behind you as a gentle barrier.
A medium firm mattress works best for most seniors. One study found nearly 50% less back pain in just 4 weeks after switching.
Now let's move to number 3, because the next position affects something even more critical. Number 3. Avoid sleeping with your arms overhead. Use the arms down position instead.
Many people fall asleep with their arms above their head, under a pillow, or stretched beside the ears. It feels harmless at first, but the damage happens during the hours that follow.
Keeping your arms raised for long periods compresses nerves and blood vessels in the shoulders and upper arms, especially risky after age 60.
This area is called the thoracic outlet, a narrow space where nerves and arteries pass between the collarbone and first rib. With age, that space tightens. Raising your arms compresses it even more.
A Cleveland Clinic study followed seniors with hand numbness and tingling. Over 60% slept with arms overhead. After switching positions, more than 70% improved within 6 weeks, no treatment required.
Circulation isn't the only issue. This position also strains the rotator cuff, the 4 muscles that stabilize your shoulder.
After 60, rotator cuff tendons lose elasticity. Research shows 40% of adults over 60 already have silent tendon damage.
Sleeping with arms overhead stresses these vulnerable tendons for 7 to 8 hours every night.
The fix is simple. Keep your arms down, at your sides or resting gently on your chest. Elbows stay below shoulder level.
To train this habit, place a small pillow or rolled towel under each arm. It creates support and discourages lifting your arms during sleep.
If you hug a pillow, hold it at chest height instead. A body pillow works especially well.
Gentle shoulder stretches before bed also help. Evening stretching reduced nighttime arm repositioning by nearly 40% in seniors.
Now let's move to number 2, because the next position affects your heart directly. Number 2, avoid sleeping on your right side. Choose the left side instead.
Right side sleeping seems harmless, but after 60, especially with any heart concerns, it can quietly stress your cardiovascular system.
Your heart sits slightly left of center. When you sleep on your right side, gravity shifts it toward the right lung, creating measurable changes in heart workload.
Cardiology research using heart imaging found right side sleeping increased cardiac strain compared to left side sleeping. In aging hearts, that extra load adds up over time.
For people with conditions like heart failure or rhythm disorders, the difference becomes even more significant.
In one long-term study, heart patients who mainly slept on their right side had over 20% more hospital visits than left-side sleepers.
But the heart isn't the only organ affected. Your stomach sits on the left. When you sleep on your right side, gravity works against digestion, allowing acid to pool and reflux upward.
Right-side sleeping triggered nearly 40% more nighttime reflux compared to left-side sleeping.
Left-side sleeping solves this naturally. It supports heart efficiency, improves stomach drainage, and even helps your lymphatic system clear waste.
To train this habit, place a body pillow behind your back to prevent rolling onto your right side during sleep.
Some people even use a gentle physical reminder, like a tennis ball sewn into the back of a sleep shirt.
For best results, elevate your head slightly. Combining left-side sleeping with mild elevation reduced nighttime reflux by nearly 90% in clinical studies.
Now comes number 1, the position researchers say matters more than any other. Number 1, avoid sleeping flat on your back. Use the elevated back position instead.
If you only change one thing after this video, let it be this. Sleeping flat on your back may be the most dangerous position for anyone over 60.
When you lie flat, gravity pulls the tongue and soft tissues backwards, narrowing your airway.
As we age, throat muscles lose tone. Studies show adults over 60 experience significantly more airway collapse in the flat position.
This leads to sleep-disordered breathing, snoring, and sleep apnea, which are not just annoying, they are dangerous.
Repeated airway collapse causes oxygen levels to drop. The brain is forced to wake you up, sometimes hundreds of nights, without you realizing it.
Long-term studies show untreated sleep apnea increases the risk of cardiovascular death 4-fold. Sleeping flat makes it worse.
Researchers found that elevating the upper body by just 20 to 30 degrees reduced dangerous oxygen drops by 61%, with the biggest benefit seen in adults over 65.
That improvement alone can reduce strain on the heart, stabilize blood pressure overnight, and dramatically lower stress on the nervous system.
Fewer oxygen drops also mean fewer adrenaline surges during sleep, allowing deeper, more restorative sleep cycles.
Flat sleeping also worsens acid reflux. Gravity allows acid to flow upward, irritating and damaging the esophagus over time.
Chronic nighttime reflux has been linked to serious complications, including precancerous changes.
Elevating the upper body helps keep acid where it belongs and reduces inflammation that can quietly build night after night.
And brain health matters too. Proper head elevation helps the brain clear toxic proteins during sleep.
When sleeping flat, this cleaning process drops dramatically, allowing harmful proteins associated with cognitive decline to build up.
Over years, that accumulation may affect memory, focus, and long-term cognitive resilience.
Head elevation improves fluid movement through the brain's clearance pathways, especially during deep sleep. The answer is the elevated back sleeping position, raising your upper body 20 to 30 degrees.
This keeps the airway open, improves digestion, and supports the brain's natural cleaning system.
Use a wedge pillow or adjustable bed so your entire upper body is elevated, not just your head.
The incline should start at the hips and rise gradually through the chest and shoulders.
If a wedge pillow feels unfamiliar at first, start with a lower angle and increase it gradually over 1 to 2 weeks.
If possible, combine elevation with left side sleeping for maximum heart, breathing, and reflux benefits.
This combined position consistently produces the strongest results in sleep and cardiovascular research involving older adults. Let's take a moment to bring everything together.
Number 4. Avoid the twisted torso. Keep your shoulders, spine, and hips aligned to reduce disc stress and morning stiffness.
Number 3, avoid sleeping with your arms overhead. Keeping arms down protects shoulder tendons and prevents nerve compression.
Number 2, avoid right side sleeping. Left side sleeping supports heart function and significantly reduces reflux.
And number 1, the most important, avoid sleeping flat. Elevate your upper body to protect your airway, heart, brain, and digestion.
These changes don't cost anything. No medication, no devices, just smarter positioning.
One change tonight. Give it 2 weeks before adding another.
Within a couple of months, many people notice deeper sleep, better energy, and fewer nighttime symptoms.
Sleep is when your body repairs itself, your brain clears waste, and your heart finally gets to rest.
Don't let poor sleep position interfere with that healing.
And remember, sleep is only one part of protecting your health as you age.
That's why we recommend watching our next video, 10 blood test mistakes seniors over 60 make.
It reveals common lab misunderstandings, overlooked markers, and simple mistakes that can delay early detection of serious problems.
Tell us in the comments, what sleep habit are you ready to change tonight? We'd love to hear from you.